The ability for us to take x-rays in-house is a major key that we use for our diagnosis consistently. So we have it here in this room. We take our patient's back. Takes just a few minutes to get an appropriate image. So this patient has seen every specialist you can imagine, has had multiple injections and treatments. No one could figure out what was going on because nobody looked underneath the hood. This patient, over the past 12 or 13 years of back pain, has actually been fusing his spine together slowly over time from the bottom up. And when he came to me 13 years in, it had gone as far as all the way up almost to his neck, okay? This is the type of patient that we can't adjust because that patient could wind up being hurt if we do actually move the joint. Instead, they should have had imaging 12 to 13 years ago, gotten ahead of this problem. That way they could have maybe intervened before everything had fused together. So we did not do any treatment for this patient. We would have been able to adjust the upper portions of the spine, but instead I sent him to a specialist to do some specific blood testing. What likely we're seeing is something called ankylosing spondylitis. It is pretty rare, and there's a blood test you can do to see if you have the gene that it typically presents with. I think it's important to see that we spend a lot of time looking at patients and what's going on with them, and we find this sort of thing more frequently than you would expect.